of the U.S. is weeks away from launching a new 3-digit hotline number that will save lives, or at least that's their hope. Starting in July, if you dial or text 988, you will be connected to the National Suicide Prevention Lifeline. This is the mental health equivalent of 911. However, many states seem unprepared with the launch date, and that is quickly approaching. Drake Clark is joining us now to explain and what kind of started this. Obviously, somebody decided it was necessary.
Well, the federal government decided it was necessary and then put all of the responsibility on the states to carry out and actually make it happen. But meanwhile, every 11 minutes in this country, someone takes their own life. That's according to the Centers for Disease Control. And some experts say America has a growing mental health crisis, especially among young people.
When 988 goes live next month, it will be the nation's newest lifeline to combat one of America's leading causes of death, which is suicide. Starting July 16th, when you text or call 988, you will have a direct connect to the National Suicide Prevention Hotline.
The timing to have this being rolled out July 16th nationwide is just wisdom.
Dr. Maxine Bradshaw is Department Chair of Psychology and Counseling at Pillar College in New Jersey.
Research have always shown that the summer month, the completion of suicide rates have increased.
46,000 people died from suicide in 2020. For children between 15 and 19 years old, suicide is the second leading cause of death, and suicide is the third leading cause of death for young Americans between 10 and 24. However, suicidal thoughts can start much younger than 10.
Children are especially at risk because they are not able to verbalize their feelings and their emotions as an adult would.
The hope is 988 can help prevent more children from dying and get them the help they need. But while the federal government mandated the new line, it's up to states to determine how to pay for it. So far, only 13 states have passed legislation for funding. South Carolina is not on the list. The state currently has just one call center, taking up to 100 calls a day. When 988 starts, they're expecting a surge, but they don't have the money to hire more staff. So those additional calls will be transferred out of state, and that could take minutes in a situation where seconds can mean the difference between life and death.
And my question is our youth going to wait that 3 minutes? Are they going to stay on the phone?
And there are federal grants available to help states pay for the operational costs. Meanwhile, other states already have well-established call centers, but they are now either enhancing or expanding their program because they realize once 988 goes active, they're expecting a lot more phone calls. Adrienne?
Well, and it's interesting, Dre, because even with the launch of this number, more people are used to calling 911. And I've spoken to firefighters who really act as EMTs and first responders to a lot of those 911 mental health or suicide calls. And that's not going to change. I mean, not in the near term.
Yeah.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.